Good morning. Welcome to the COVID-19 Emergency Response LDI Huddle Call for September 20th, 2021. It looks like we're continuing to see rays of hope come through, and Karen's going to give us some more with our key statistics.
Hey, good morning. So our 14-day positivity is now 18.4%. Our 7-day positivity rate is 15.9%, and our 7-day average patients, we're seeing 82 patients per day that are coming back positive. So that's much better than what we looked at last Monday when we were at 132. Our 10-day projected census is 142 patients. Our COVID inpatient census this morning is 148. 94 of those are in full isolation. 54 are out of isolation. At Berkeley Hospital, they have 10 total, 6 in isolation, 4 of the isolation has been removed, 5 in ICU, 3 on ventilators, and no ER holds. Mount Pleasant has 35, 24 in full isolation, 11 the isolation has been removed, 9 in ICU, 5 on ventilators, and no ER holds. Roper has 56, 35 in full isolation, 21 the isolation has been removed, 15 in ICU, 11 on ventilators, and no ER holds. St. Francis has 47, 29 in full isolation, 18 the isolation has been removed, 7 in ICU, 6 on ventilators, and no ER holds. So currently we're holding no COVID patients in our ERs, which is a huge change from last Monday. When you look at vaccinated versus unvaccinated, 82% of our COVID patients are not vaccinated, 83% of our ICU COVID patients are not vaccinated, 88% of our ventilated patients are not vaccinated. Home care has a total of 72 patients, 7 in home health, 2 in home hospice, none in the hospice cottage, and 41 pending admissions. That's the numbers for today. Thanks.
All right, thanks, Karen. So definitely an improvement in the average positive patients per day, so hope that continues to trend that way. Moving on to operations, teammate health, Dr. Blade.
Good morning, everybody. Last week, we had 22 new cases of COVID-19 in our teammates, which is, again, a substantial decrease from the last couple of weeks. Half of those were vaccinated, half of them were not vaccinated. But since 78% of our population is vaccinated, it still demonstrates a substantial protection of the vaccine against COVID-19. We'll have more updated information on the quants on Wednesday. I'll toss it over to Sarah for the workforce update.
Good morning, everyone. We currently have 53 teammates out. 14 of those are RN job titles. 30 of the 53 are unvaccinated. We are following 37 positives, and 22 out of those are unvaccinated. And the other number there is 16 in the testing process, and 8 of those are unvaccinated. We just saw 3 forms submitted yesterday and 2 added to our testing process, so that was a nice quiet Sunday. And we also released 14 teammates to work yesterday, and 6 of those are on job titles. And that's all I have.
All right, thanks, Sarah. Moving on to booster shot planning with Doug Bryan.
Yes, we do have vaccine clinics or booster clinics planned next week for Tuesday, Wednesday, and Thursday. We're anxiously awaiting approval from the federal government for healthcare worker booster shots and possibly also booster shots for those above 65. Hopefully we'll get that approval later this week and move forward with the clinics next week. Please stay tuned to corporate communications for more information.
All right, thanks, Doug. Moving on to acute care ops, Dr. Segan.
Yeah, good morning. I have 2 brief updates this morning. First of all, I just want to remind everybody that we will be restarting an elective inpatient surgical surgery schedule starting on Wednesday of this week. We are starting again with a very reduced schedule, and we'll continue to ramp up that volume as the COVID census continues to fall, and be tracking all the volume very closely to make sure that we're not overstressing our capacity, looking at both beds and staff. The other important update is that we have come to agreement with the critical care APPs, and we will now have that coverage going live at Mount Pleasant. Actually went live yesterday, Sunday. So we now have 6 hours of critical care APP coverage at the Mount Pleasant ICU, which will supplement the 6 hours of intensivist physician coverage that we have, providing much needed support for that campus. And that's all I've got to report today, Chris. Thank you.
Thanks, Dr. Segan. Moving on to nursing update with Risa.
Good morning, everybody. Today we have 23 more nurses and respiratory therapists joining us related to our ProLink engagement, which is our most recent engagement around the COVID surge. That will bring that contract about 80 to 88% completion. Grand total, since we've started bringing nursing staff on, August 23rd being the first drop, we have 166 nurses and respiratory therapists engaged to help us care for patients during this really difficult time. And that's all I have.
All right, thanks for all the hard work, Risa, in getting that not just filled, but also placed. So strong work to your team. Moving on to ED update with Marcella.
Good morning. The EDs are continuing to see strong volumes even over the weekend. Our boarding has definitely decreased. Presently, we are boarding 13 patients in our emergency departments. Best I can tell, they're all COVID negative. That's all I have for today.
Thanks, Marcella. Moving on to physician partners operations, Jim Bowen.
Morning, the Express Cares over the weekend did really well. It is customary of a traditional flu season, so the volume has definitely come off some. On Friday, 22 practices, primary care practices, received small batches of Pfizer vaccine, so they are prepared for potential booster shots, and most of those practices have made initial orders for Moderna. That completes my report.
All right, thanks, Jim. Dr. Oliverio, monoclonal antibody infusion update.
Good morning. We had a successful run on Friday for both morning and afternoon shifts. We were able to infuse 9 patients, and they did very well. We're very happy. We're moving quickly to full capacity, and we have capacity at this point. And so just remember to use the online referral form on Careline. Just go to the COVID webpage, and you'll see it right under infection prevention. That's all I've got. Thank you very much.
Thanks, Dr. Oliverio. Logistics and supplies, moving on to oxygen supply with Ken Hill.
Good morning, everybody. We completed our assessment of the oxygen flow throughout the facilities. Of note is Roper. We found that we can sustain the oxygen flows to the current COVID units and to add some of the other units for expansion if necessary. There was a recommendation to reduce the number of rooms on 2 HVT. That'll help us eliminate the high pressure alarms. The other facilities are stable and can support the flows that we currently have with some of the expansion if necessary. And that concludes my report.
Thanks, Ken. Doug Robertson with material update.
Good morning. Supplies are in stable condition. Thank you.
Thanks. Pharmacy update with Francis Wyckoff.
Good morning. We have 255 doses of Regen Cove available this morning. We have 211 of BAM Itizumab combination available. COSI is still in critical supply. We had a slight improvement in our Nimbex inventory. We currently have better than a 10-day supply at all facilities. That ends my report.
All right, thanks, Francis. Vanessa with the lab.
Good morning. We've noticed a decrease in the burn rate in all platforms except for our BD Max. That's the primary platform for screening patients. And we are going to be starting the validation of the COVID Sept multiplex assay in the coming weeks. So we'll be able to offer the multiplex. It's flu A, flu B, COVID, and RSV on the Sept. And we're still on track for a go live of Monday, September 27th for our Cobas 6800. That's it for the lab.
All right, thanks, Vanessa. Thanks for all the hard work getting that up and going. Moving on to Andy Lyons for public information update.
Yeah, we'll update our numbers. We'll also talk about all the new nurses headed our way. We have puppies from the Animal Society coming to Berkeley Hospital on Wednesday. We have a message about help needed for a new infusion site at Roper. We're planning to do booster shots next week, and we'll kind of have a general roundup of all the news that people have been seeing and the fact that we're waiting on federal government approval. We'll have a reminder about our partial resumption of our surgical schedule, and then we'll have a really good news story about an award Mark Dixon got for his years of service. That's it.
All right, thanks, Andy. So as everybody could hear, we are seeing some numbers come down as we hoped and predicted they would. So that's good to see. We're starting back up surgeries. We'll ramp those back up as the volume allows, understanding that this is a fluid situation and can go the other way. If we start seeing that, we may have to make some mid-course adjustments, but hopefully that will not occur. I want to encourage everybody to continue to look at your unvaccinated teammate list, and let's manage those and try to encourage folks to either get the exemption forms filled out or enter into the first dose vaccine clinics and get their first dose underway. We're still holding that November 1st deadline for completion of all vaccines. And then again, want to just remind everybody there will be first dose clinics at all of the acute care sites through this week. So look at Caroline for those updates on where and when. And also, as we said earlier, just want to highlight, the booster shot decision has not been made yet. There was some recommendations that came out, but not a formal approval. So we're waiting for that, hopefully this week, and then begin those shots next week. So stay tuned, and let's get those as soon as we can once we get approval. Again, thanks for all the work you're doing. I encourage you to keep yourself safe both at work and at home. Thanks a lot.